we're stretching your minds, and now we're going to stretch your minds one final time, literally, with a mind-skin communication. It's another double act. It's Rukshana Ali, who is a clinical psychologist, interested in knowing how the mind and the skin work together, but also Shona Cameron, who's one of our trainees, who is interested in sleep. I think we're all interested in sleep now, aren't we, in this weather, but your research is particularly interested in how the mind works relating to sleep and some of the dysfunction that we see in the skin. So this is the Rukshana show, first of all, I think. Are you speaking first?
Yep.
Very good. So over to you, and then afterwards, Shona will take over.
Thank you so much for inviting me. So I'm going to give you a bit of an overview, thinking about the mind and skin connection. And I wanted to give a bit of context because I was part of this all-party parliamentary group on skin, and it involved MPs as well as health professionals and patient advocate groups. And what it did, it reviewed the mental health impact of people living with a skin disease and what kind of support they needed and what kind of provision there was already out there. And we surveyed 544 patients, and what we found was 98% said that their skin impacted on their mental health, but only 18% actually received any kind of psychological or psychiatric support. And we've done follow-up studies since then, and what we found has been that actually that was because there was a lack of psychologists or psychiatrists based in dermatology clinics, but actually that is improving. And some of the other results that we found were that 93% of the patients surveyed said it affected their self-esteem, it affected their leisure activities, it affected relationships, including intimate relationships. Work and education was also impacted on, as well as sleep. And interestingly, 5% of those 544 patients reported experiencing suicidal thoughts, and I'll go into this a bit more. So for me, when I meet a patient, I think about this. I think about what's their journey been. I try and put their experiences in context. And often we know that when patients have a skin disease, they might be trying to manage it for a long time by themselves, and it might start to impact on their life and disrupt other things. So actually then they might think, well, I need some help. So they'll go and see their GP, and they might be offered some treatment, and it might be a bit of a back and forth between the GP and other specialties or A&E. And throughout that time, they might start to feel a bit despairing, a bit hopeless, a bit like things aren't going to plan. And then eventually they might get referred to a dermatology team in which there's a bit of hope. But what we know is that often when treatments start, there can be delays or there can be other tests that are needed before they can start the most appropriate treatment. And actually that isn't the end of their journey, because we know that there's other challenges that occur. And there's been lots of research in psychology looking at the impact of skin disease, and these are the 7 main areas that patients report. So sleep is a big one, and I know Dr. Cameron's going to talk a bit more about this, but especially in eczema, for example, 90% of adults living with eczema report that their sleep is disrupted. And parents looking after children say 60% of children's sleep is disrupted. And that can often be because of the itchiness or because they're then disrupting other members in the household. Again, if you're not sleeping properly, it's going to affect what you can do the next day, like going to school or going to work. So then you're not, even though you might be there, you might not be able to concentrate or you might not be as productive. And again, that has another financial impact. And families as well, they're often forgotten about in a lot of research, but psychologists always think about the system. And families report that around 80% of their lives are often disrupted due to a skin condition. So it could be that, plans are often disrupted at the end because there might be a flare, or actually they might not be able to do things with invites that they want to do. Or it might be that, for example, I'm thinking of somebody I saw this morning who spends a lot of time looking at their acne in the mirror, and actually that then delays on whether they can go out with their friends or their family. And similarly, friendships and relationships are impacted on, and students especially report that because they're often missing a lot of school, either coming to appointments or because of their uncontrolled skin disease, that then they're not able to make those relationships and friendships. So some of the work I do is supporting young people with learning, how do you say hello to somebody? How do you make friends? And as people get older, it might be then intimate relationships. So again, we know that if you're living with a skin disease that perhaps has lesions around your groin, it then might impact on whether or not you feel comfortable having an intimate relationship. And again, we've talked a lot about appearance concerns, and there's a high degree of stigma and shame in people living with a skin disease, and often they can feel rejected by others. Some of the young people I see talk about treatment and the treatment burden, about not wanting to put on their creams at school because they then fear that that might draw attention to them, or asking for time out because, again, people might ask why. And again, if people have already struggled with their mental health before having a skin disease, we often know that the skin disease can amplify this. And for other people, it might be that psychological distress comes as a part of the skin disease because actually they're then having to change their life. And I think it's really important as well to touch on risk and suicide. So a study looked at people, adults living with eczema, and what it found was 44% of those surveyed were more likely to experience suicidal thoughts. Now, just to put this in context, comparing with adults living with a cardiac or a metabolic disease, they experience around 20% of suicidal thoughts. So actually, we know that dermatology patients are much higher risk. And similarly, with adolescents, another study found that 15.5% reported more suicidal thoughts than those children without any eczema. And more recently, researchers started to look at the relationship between ADHD and eczema, because we found actually the eczema population is more likely to experience ADHD or ADHD-type symptoms, which then impacts on school or work. So moving forward, what we do know is that there's much greater awareness about the relationship between mental health and skin disease. And actually, dermatologists are working really well in terms of thinking a bit more about this. And I've popped on my little octopus because I use this in my clinic all the time. I've actually got a model. And I tell young people when I see them that the body is like the tentacles of the brain. So actually, they can really see that mind-skin link. And I know that Dr. Cameron now is going to talk a bit more about this, the research that's been done in the mind and skin.
Thank you, Rukshana. So I am speaking on behalf of Professor Carsten Floor today, who unfortunately can't be here as he's sunning himself in a lovely Greek island somewhere. But we really wanted you all to hear about the mind and skin study, so I hope I can do this justice. So it is an observational study that really for the first time, looking into the links between eczema, inflammation, itch, and sleep disturbance in children with eczema. So for those of you who don't know, or to remind those who do, so eczema is one of the most common skin conditions. As we've heard from previous speakers, it's caused by a mix of genetic susceptibility and environmental risk factors, and this leads to a skin barrier problem. Patients with eczema have very dry, itchy, inflamed skin, which are really the hallmark features of this disease. However, we know that lots of our patients also have lots of psychological sequelae following this chronic itch, such as sleep disturbance, ADHD, and psychological stress. But it's probably a lot more complicated than this diagram suggests. This is probably the commonly held view of itch causing sleep disturbance, which then leads to ADHD and psychological stress. But we actually think there could probably be several more arrows on this diagram, and it's a lot more complex than this, this is a very technical diagram. However, I would like you all just to appreciate that we've drawn on research done in lots of areas outside of dermatology, such as from our psychiatry colleagues and our sleep colleagues, as well as immunologists, to try and draw together a more complex picture of why we think our patients with eczema have such bad sleep disturbance, and why this can often persist after treatment of the skin. So we're now very lucky in eczema that we have some brilliant therapies that really work and cure the skin symptoms. However, our patients are often left still with very poor sleep, ADHD, and low mood. So we think that maybe looking more into these mechanisms, we might find some more answers. So an innovation workshop was held from specialists across King's, from psychiatry, ADHD specialists, as well as immunologists. And we started putting together a plan of how we can really look into the causes of this. And the part of the project that I'm going to talk to you about today is the mind and skin. And this is really looking at the hypotheses that children with severe AE have abnormal cognitive function associated with systemic inflammation and impaired sleep. My research degree was looking partly as well at the bottom work stream, which was exploring the lived experiences and psychosocial functioning. And that really reiterated that patients with eczema really suffer with sleep disturbance. And as Rukshana was telling us, this then infiltrates all areas of their life and other members of the family as well. I also spoke to healthcare professionals, and we all ask about sleep. We all know that we want to be giving our patients this holistic management of their disease. However, it was pretty much agreed across the board that we really struggle to treat patients' sleep. And yeah, again, we reiterated that we actually find treating the skin easier these days with systemic treatments, but unfortunately we remain somewhat at a loss of how to help sleep, which can be really disheartening for everyone, for parents, children, and healthcare professionals. So the Mind and Skin project, which is hoping to explore all of these links and answer some of these questions, is recruiting children aged 12 to 18 across three participant groups. So group one are patients who are living with severe atopic dermatitis who are about to start a systemic treatment, so an injection therapy or a tablet therapy. Our group two patients are 12 to 18-year-olds who use cream for their topical therapies for their eczema. And we're comparing this with a third group, which are our patients, our healthy controls or patients without eczema. So all three groups will have baseline investigations done, and we're doing sleep studies, we're doing cognitive function testing, we're doing functional brain imaging, as well as skin assessments and specific skin investigations, such as cytokine and inflammatory biomarkers. And then in the group one patients, we're going to start the medication, and we're going to repeat the tests 4 to 6 months after they've started the medication, so we're able to see if any of these markers change. So this is a bit of a plug actually as well. So telling what does it involve? If there's anyone in the audience who wants to get involved, we are still recruiting to this study. It is quite an involved study, but all our participants who've taken part have really enjoyed it, and it can actually be quite an educational day for adolescents who have an interest in science or healthcare to come along and be part of research. So it involves 2 visits where we do the test that I described previously, and patients do get £50 for taking part. So this is just to show you all the sleep devices that we're doing, as this is probably quite new to most people in the room. Sleep research is really difficult to perform, especially in the patient's own home, which is what we're doing here. So on the right here, we have the gold standard of care, which is called polysonography, and this is what we currently use in the NHS. It's very cumbersome. You have to attach lots of leads to the head, but you get lots of information, and you can diagnose sleep problems. But it's very time-consuming hooking people up to these machines, which is why we're also going to be looking at these 2 new devices on the left-hand side, which is the Dream headband and the MFit mattress sensor, and these are more novel sleep devices. The Dream headband measures EEG data similar to a PSG, so brain waves in the brain, And the MFIT measures similar markers such as movement and respiratory rate, which we can then extrapolate what stage of sleep we think someone is. And sorry, this watch down here as well is actigraphy, which is quite a standard method of collecting sleep data. So we're collecting lots and lots of data, which is hopefully going to teach us something about sleep in children with eczema, which hasn't been explored very much to date. We're also doing a functional MRI scan in these patients. So that means when the children and adolescents go into the scanner, they're asked to do certain tasks, sort of like computer games. They have a reaction test and certain games that they play. So we can see which part of their brains are working. This is commonly used in ADHD research. And so we'll be comparing this data to cohorts of ADHD patients, hoping again to learn more about this. There's some really interesting work being done in America, for example, that shows lots of similarities on fMRI scans between patients with ADHD and sleep-deprived patients. So I think that tells us we probably don't understand the full picture about ADHD. So if anyone's interested in getting involved, here are our details. Or anyone's children would like to get involved, by all means, email us. This is all the collaborators who we're working with, which really is an impressive collection of researchers in their own right from their own specialties, and which is why also that makes this such a, hopefully, an impactful project. And that's everything. Thank you.